Assalamu alaikum wa rahmatullahi wa barakatuhu. Hi guys, this is Shahadat, and today I'm going to read a scientific paper for you. This paper was published in the Open Access Journal and in the Diabetes Management section. The title of this paper, which is a case report, the title is A Clinician's Guide to Inpatient Low Carbohydrate Diets for Remission of Type 2 Diabetes toward a Standard of Care Protocol. The paper was authored by Mark Cucuzella, Adel Haidt, Kathleen Peterson, Laura Suslow, Rory Heath. In this first video, I'm going to read the abstract and the introduction part, and there will be other videos after this to cover up the other parts of this paper. So, without further ado, let's start. Abstract. Type 2 diabetes, T2DM, is most often treated as a chronic progressive condition. However, both clinical experience and scientific studies have shown that remission indicated by normalizing of blood glucose levels and safe medication reduction through lifestyle change should be considered an achievable clinical outcome for patients with T2DM. Dietary interventions that include therapeutic levels of carbohydrate reduction can be used by clinicians to help patients reach this goal, as evidenced by clinical experience and clinical trials. However, many clinicians and allied healthcare providers have not been trained in how to administer these therapies. This article demonstrates the successful implementation of therapeutic carbohydrate reduction for T2DM in an inpatient setting through the institutional example of a small rural hospital in the US. It provides definitions for therapeutic carbohydrate reduction and rationale for its use in an inpatient setting in patients who present with T2DM. The article outlines a 7-stage protocol developed from practice-based evidence to be used in an inpatient setting to minimize the requirement for insulin or other hypoglycemic medications and to normalize markers of T2DM in patients with this condition. The protocol consists of number 1, patient selection, number 2, pre-diet evaluation and counseling, number 3, patient education, number 4, initiating the dietary intervention, number 5, managing medication changes, number 6, addressing any side effects, and number 7, follow-up. This protocol serves as an initial framework for developing clinical practice guidelines and standard of care for using carbohydrate reduction as an intervention for T2DM and related conditions in an inpatient setting. It also indicates the potential for providing clinicians with the opportunity to help patients put T2DM into remission rather than just manage its progression. They repeat the title of the study once again at the end of the abstract, which is, it says, A Clinician's Guide to Inpatient Low Carbohydrate Diets for Remission of Type 2 Diabetes toward Standard of Care Protocol. Now I'm moving on to the introduction section. Introduction. Type 2 diabetes mellitus, T2DM, is now considered a global pandemic. Recent estimates from the World Health Organization indicate over 400 million people worldwide have diabetes. Reference 1. In the United States, at least 23 million people have been diagnosed with diabetes, and it is estimated that nearly 50% of the US population may be classified as having prior undiagnosed diabetes. Reference 2 and 3. T2DM is a leading cause of morbidity and mortality and is a significant factor in increasing healthcare costs due to its extensive complications. The American Diabetes Association estimates the annual cost associated with T2DM to be over $300 billion in 2017. Reference 4. In January 2017, the American Diabetes Association and American Academy of Family Physicians labeled T2DM as a chronic progressive disease. Reference 5. However, both clinical experience and scientific studies have shown that bringing progression to a standstill and even reversing the clinical manifestations of T2DM should be considered an achievable clinical outcome. Currently, in the literature, there are 4 methods to place T2DM into remission: bariatric surgery, reference 6, extended fasting, reference 7, a very low calorie diet using a meal replacement formula, reference 8, and a low carbohydrate diets, reference 9 and 10. Low fat, plant-based protocols have been suggested as first-line therapy for diabetes management, but the most intensive protocol failed to achieve remission of T2DM over 74 weeks as hemoglobin A1C, in short HbA1c, reduction was 8.1 to 7.6, reference 11. Low carbohydrate diets are therapeutic. Low carbohydrate diets are therapeutic interventions that clinicians can use to help patients discontinue medications for hyperglycemia and achieve remission of T2DM, reference 9 and 10. Excuse me. For patients, this approach may be less extreme, safer, and more acceptable than bariatric surgery, extended fasting, and a very low calorie meal replacement. At the same time, low carbohydrate dietary interventions are not clearly defined in the literature, and many clinicians and allied healthcare providers have not been trained in how to administer these therapies. This article serves as an initial framework for developing clinical practice guidelines and a standard of care for using carbohydrate reduction as an intervention for T2DM and related conditions in an inpatient setting. Dietary modification in the form of carbohydrate restriction was a primary form of diabetes care before the advent of insulin therapy, reference 12. The use of exogenous insulin revolutionized the care of type 1 diabetes and also became established as a therapy in T2DM, despite the differences in underlying pathophysiology. The ubiquitous use of insulin and other pharmacologic strategies to reduce glycemia overtook the low carbohydrate diet as a standard treatment of T2DM. This shift was accentuated by the US Dietary Guidelines emphasis on dietary fat restriction with a concurrent emphasis on increasing the proportion of dietary carbohydrates. However, there has been increased interest in the therapeutic potential for carbohydrate reduction for the treatment of metabolic disease over the past 10 years. Although it is well accepted that close glycemic control is an important factor for preventing microvascular complications such as neuropathy and retinopathy, modern treatment of T2DM using pharmacological approaches does not consistently normalize HbA1c and has not been shown to consistently slow the progression of patients towards diabetic complications, morbidity, and mortality, reference 13. Furthermore, recent studies have suggested that reliance on more intensive treatment may be detrimental. The Action to Control Cardiovascular Risk in Diabetes, in short ACCORD or ACCORD trial, which compared intensive versus standard insulin and medical therapy, shows that intensive medical treatment carries an increased risk of all-cause mortality, a 35% increased risk of cardiovascular mortality, and a greater risk of hypoglycemic events and weight gain of 10 kg in comparison to those on standard therapy, reference 14. Other multinational, multi-center randomized controlled trials aimed at achieving tight blood glucose control with medications failed to demonstrate the expected reductions in heart disease, the primary cause of mortality in patients with diabetes, or in overall mortality, reference 15 through 20. In contrast to these outcomes, strong evidence exists for promising alternative approach. The recent literature regarding the risks and benefit of intensive glycemic management of T2DM have influenced the relaxation of the HbA1c targets in the American College of Physicians guidance statement, reference 21. This reflects the current uncertainty regarding the prioritization of glycemic control in the pathophysiology of T2DM. Dietary approach to improve glycemic control through carbohydrate reduction are often overlooked as a safe, effective means to normalize HbA1c levels without escalating medication therapy and the risk of hypoglycemia and other adverse events. A low-carbohydrate diet can be a useful tool for clinicians to safely achieve clinical improvement but challenges to implementation in a clinical context remain. Confusion about different types of carbohydrate restrictions, unfamiliarity with the dietary intervention, concerns about over-medication, time constraints, institutional inertia, and limited resources all present significant barriers to implementation of a low-carbohydrate diet in a clinical setting. This article provides a case study of one hospital's use of low-carbohydrate diets as a therapeutic intervention in an inpatient setting. The article defines the various levels of carbohydrate reduction, describes the therapeutic potential for low-carbohydrate dietary interventions for T2DM, and discusses how this therapy may be used in an inpatient setting with transition to outpatient care. By outlining a clinical protocol and providing resources for implementation of a therapeutic low-carbohydrate dietary intervention, some barriers to using this intervention as an inpatient intervention for treatment of T2DM and related conditions may be reduced. In this video, I'm going to stop here. I'll start reading the next section, which is highlighted, or the title of that section is Defining Carbohydrate Reduction, in the next video. This is pretty long paper, so I think I'll need a few videos to cover the whole lot. So part 2 will start from defining carbohydrate reduction. I'll hope to see you in the part 2 of this video. Take care. Bye-bye.